interview happen, but of course our special guest is a very, very busy person for very good reasons. But we are happy to have in our program today someone who means so much to me and my wife, and someone who we've come to respect and appreciate what she does, both as a professional and as a human being. I'd like to welcome to the program today Dr. Timea Belej-Rak.
Thank you so much for having me. It's wonderful to see you.
Yeah. Today is going to be not like our regular program, because today is it's something that is close to our heart. Our program today is going to just be a reflection on our relationship with Dr. Belej-Rak, what we've been through with her, what she has been through as a person. So it's just going to be a mixture of things, a marriage of experiences and obstacles and challenges that we've all faced. But then the other very important part of this whole thing is that she's going to be able to share with us her professional knowledge in what she's very good at. And so just stay tuned and be rest assured that you're going to learn so much from our discussion, from our sharing, and from our exchanges. Now, Dr. Belej-Rak, I'm going to start where we always start. I want people who have not met you before to get to know who you are. So, who is Dr. Timea Belej-Rak? Who are you?
I'm a fun-loving individual who loves helping people like you. That's number one. And I'm also an obstetrician gynecologist, and did all my training at the University of Toronto. My bachelor's, my master's, my medical school, my residency, and then my fellowship.
Everything.
And so after 17 years, finally my husband said, you know, you do have to go to work one day. Not be a perpetual student.
So who's a gynecologist?
Oh, obstetrician gynecologist.
I was going to cut my tongue. So,
yes,
so who is that?
That kind of physician helps deliver babies, but also helps women with any gynecological issues, so reproductive issues or like heavy bleeding, fibroids, things like that. But then beyond that, I did an extra 2 years of training just for fertility issues, and so that's a subspecialty within the obstetrics and gynecology. Yes.
Wow, that's a mouthful. You already answered the second question, because I was gonna. So, take us back a little bit. How did you end up being a gynecologist? Can I just say gynecologist?
Oh, sure, yes.
Okay. The other part is tongue twisting. How did you end up? Take us through your childhood and how? We want to see how you ended up. Or did you just wake up and decide to be a gynecologist?
So it all started in my grandfather's barn.
Wow.
Back home.
Wow.
So he had some...
Where is home?
Czechoslovakia. So it was Czechoslovakia at the time. And so he had like a barn, and he had some needles in there, and I remember kind of sticking his finger with the needle, and so I guess something sparked there. And then we came to Canada, and I learned to speak English, and I met my best friend to this day, Sylvia. So we've been friends since 1983.
Whoa.
And so she taught me how to speak English.
Wow.
And then in high school is actually where I discovered my love of biology and science in general, and then particularly women's health. And so I just found it easy to remember. I found it very interesting and fascinating.
Yeah.
And I decided in high school that I wanted to be an obstetrician gynecologist.
How old were you when you came to
I was 11.
11. So prior to that, you didn't know English?
No. And I was in a special math school and in a special math class, so who knows what I would have become had we stayed back there.
Wow. Okay, so already, like I said, a lot of the questions I was going to ask have already been answered. So I was going to ask, when you had that dream, I mean, after you saw your grandfather and you had this desire to do something that had to do with medicine, and then I was going to ask what you did. Take us through your practice, because that's where we met you. Okay, so how did you establish your practice?
So then when I was finishing the fellowship,
Yeah.
well, first of all, I didn't even know I wanted to do the fellowship, because already the obstetrics and gynecology was 5 years.
Okay.
And already in my 3rd year of the residency, I was out there interviewing for positions. I'm like, I'm ready, I'm done, right? This is enough school.
Yeah.
But then we did the rotation in infertility, and I found that it took me to the other end. So I went into obstetrics to deliver the babies, but now I was able to help create them.
Oh.
And so that just fascinated me, that I could help create life from the very beginning. And then I decided to do the fellowship after all.
Wow.
The extra 2 years.
Yeah.
And so then when I was finishing, I started interviewing at different clinics, and I had a very good interview at the time it was called LifeQuest,
Okay.
Center for Reproductive Medicine, and that's where I ended up having my first job in 2007.
Wow.
Honestly, I think the reason why you had that job in 2007 was because we were coming to Canada in 2007.
Oh.
Yeah, because 2007 when you started there, incidentally, that's when we came to Canada.
Oh my goodness.
Oh yes,
Exactly,
that's when we came to Canada.
Yeah.
And we were coming from Nigeria, and how many years after marriage? We had just, I think 4 years after marriage, we had come to Canada. And then we had tried so much to have a baby. We
It
discovered
was 3 years actually, 3 years.
3 years.
Yes, we got married in 2004.
We got married in 2004, and soon after a year, because when you get married back home, they start counting the days
Yes.
for you.
9 months.
They start telling you
Where's
something.
the baby?
No, at the reception hall, the people will be like, we're coming in 9
months' time,
celebrate
yes.
it. So it's like the day you're wedding, that's the day you start trying. So after 1 year, we realized no babies.
Yeah.
You know. Well, not after 1 year, after a couple of months, we realized no babies. And she started having very heavy
Menstrual periods, very heavy, yes.
Talk about
okay, I started having very heavy menstrual periods, and we went to see a family doctor of ours then. He's of blessed memory, Dr. Iseko, and he ran tests and did everything and said, oh, Erica, you have multiple fibroids. And then, I was devastated because I didn't really understand, I thought, well, like, okay, I'm done. That's it, no babies. He said, no, it's nothing. You should just, he talked to us that we should, come, let him, perform a surgery and take it out. But I was scared. We're kind of scared, like, okay, we've not had a baby. Like, we didn't know if it would prevent us from having kids. And, the doctor kept telling us that, no, it wouldn't. I mean, medical science has been so much advanced now that, he could do it and you go ahead and try.
But the major thing that put fear in us was the environment, the culture we're coming from.
Yes.
Whenever you said you had fibroid, and we were good Christians, we're strong Christians, they will always say, no, you cannot have surgery. That fibroid, first of all, fibroid was almost like you committed a sin.
Yes.
That's why you have fibroid. So that you cannot be barren and all of those things. So we were so scared of someone even touching your womb. And then they had so many cases of people who tried to do it and then they died in the process.
Yes.
So we didn't do that until
we told him we're traveling, we told him about it. So he said, okay, fine. We should go ahead, but we should discuss with our doctor when we get there. And then we came over and then we met you.
Okay, so we came here and we met. We already had a family doctor through your visits to Canada previously.
Okay, Dr. Beluso.
Yes.
He was
the one that actually,
he was classmate.
Yeah.
So when we met him, he, after going through certain, talks and everything, he said to come meet you.
Yes.
And that's how
recommended
we came
you.
to
Highly
meet
recommended.
you. And
Yes.
so when we came to you tell us what you saw.
So when we first meet, we take a full history from both of you,
Okay.
and then we examine Erica at that first appointment, listen to your heart, lungs, do an internal exam, a quick ultrasound, so we get an idea of what may be going on.
Yeah.
Then we also do blood work. So the blood work usually involves infectious disease blood work, HIV, hepatitis A, B, C, syphilis, things like that. We check your hemoglobin level, your blood types, because sometimes there can be an issue with the blood types. And then we monitor your cycle, Erica, to see if you're ovulating and when you're ovulating. That consists usually of blood work and ultrasound, so that's what is referred to commonly as cycle monitoring. So that's in the mornings, and that can be stressful as well.
Let me tell you about it. Because that was when we were new in Canada, and we didn't have a car.
Yeah.
We're living in Scarborough,
all the way to
and we
east.
need to come downtown.
Oh,
Very early in the
So
morning.
those early mornings, we had to wake up, had to do like 1 hour.
Yeah.
To come over, and then we had to come. I think she wasn't supposed to be. She wasn't supposed to eat or something.
I can't really remember if I was supposed to.
Are you supposed
You
to
can
eat?
eat. You can
Okay,
eat.
yeah,
Yes.
Yeah, I
There
think there was no
was-
fasting because it was almost every
And
day.
we're in U of T also.
Yeah,
Mhm.
taking
Were we
a
in U of
course.
T then?
Yes. I think we had started at some point.
At some point, but
Yes.
but it was anyways. But having to come very early in the morning, and then when we came, they wouldn't open your front door.
Yes,
So there was
we
we had to go to the
line up.
back, and
Yes.
it was crazy. But yeah, we did that, and when you said we had to test for, there were so many things, all the
Yes.
diseases in the world. You said HIV, hepatitis. We're like, oh my goodness, how are we gonna escape all of those things? So at what point did you? Okay, so after you diagnosed, what did you?
So then we also check your uterus and your tubes to make sure that the fibroids, for example, are not pushing into the uterine cavity, because
Okay.
those ones can affect pregnancy chances. And we had to make sure that your tubes are open. And then we had to check your sperm, so that's
Okay.
that
To
can be
make
a
sure, like-
stressful experience
Yeah.
for the men.
Oh yeah.
To produce a sample, because I think a lot of time they fear that
Yeah,
it
the-
may be
Yeah.
it may be an issue for them.
And talking about that, that is also something that we find in our culture, and not just in our culture, so many marriages where they just assume.
Yes.
So the woman assumes is the man, and the man assumes is the woman, and the man's family puts
I think it's more on the woman.
Mhm.
It's tilted more on the woman. They
They always
blame
think
the
it's the
woman. They always
woman's
think it's the
problem.
woman's
Yeah,
fault. Yes,
yeah.
yes.
Or as
yes.
soon as we find something in the woman like fibroids, it must be
Yeah,
the fibroids.
yeah,
right,
exactly.
right.
Yeah,
bring it
yeah,
on,
yeah,
yes.
yeah.
But
So it was important to do the sperm
Yes,
test to make sure that the man's sperm is also okay.
because in about 1/3 of the cases, we do find an issue with both partners. So even though there's an
Okay.
issue with the woman,
Yeah.
in 1/3 of the cases, there's also an issue with the man.
Okay.
Yeah.
Okay. So after so what did you discover, and how did you decide on what is the first treatment we're going to undergo?
So then after we do all the tests, then we meet, then we review all the results together, and then we decide on the treatment plan. And so I remember from the beginning we knew about the fibroids,
Yeah.
but because it's not clear what role they play, and because the surgery can be tricky, and I think because
Yeah.
there were a lot of them,
Yes.
we decided
yeah.
that the safer thing would just be to start treatment. The first line treatment usually involves giving you the fertility medications to get you to produce more than 1 egg per month, because on our own, normally we only produce 1 egg every month.
1 egg.
Yeah.
A woman produces 1 egg.
Every month, yeah.
Oh,
Yeah.
that's so risky.
Yeah, and then with that, so the fertility drugs get us to produce somewhere between 2 to 4 potential eggs. And then with that, we do the intrauterine insemination, where we take the sperm, we process the sperm, we take out the best sperm, and then we place them into the woman's uterus.
Okay. I have a question.
Yes.
I remember, was that when we had the hyper
Oh,
stimulation?
not yet, not yet.
Not
No,
yet,
so-
okay. That's okay.
So after, usually if the insemination doesn't work, then the next main and the most intensive treatment is the in vitro fertilization.
Okay.
Okay.
So the other one is the IUI.
That's correct, yes.
Okay.
What's
Yeah.
IUI?
IUI, intrauterine insemination.
Intrauterine insemination.
Yes,
Okay.
yes.
So we tried that and it didn't work.
Right.
Okay.
So that one, if that does not work, then usually the next step is the in vitro fertilization. So that's the one where we give you lots of medications, much more than for the insemination, and they're
Okay.
actually injection
Yes.
medications.
Yeah.
I remember I
was-
used to have it lots.
Oh my
this-
goodness!
yes.
Like every day
Yeah.
you had
Yes.
to push.
Yeah.
The pen. It was a
Yes,
the pen
The
type.
pen
Yeah.
thing.
Exactly,
Yeah,
exactly.
yeah. So we do that for a period of.
The injections are for about 10 days.
Okay.
For about an average of 10 days. And then sometimes, yes, one of the side effects or risks is hyperstimulation syndrome.
Oh,
So
okay.
that's where from the high estrogen levels, your vessels get leaky and you can get fluid in your lungs and in your abdomen. And that's why we decided not to do the fresh transfer.
Yes,
Oh,
I
Because
remember.
okay.
you had developed some fluid in
Yeah.
your abdomen.
Yes.
And the safest thing was to freeze the embryos.
Yeah.
And wait.
Yes, and until it resolves, yes,
Yeah.
Okay,
yeah,
okay.
yeah.
I remember that it was very uncomfortable. My tummy was like, it was like, big and turgid, and like you couldn't even.
But let me
It was-
say
It was
something.
something else.
Now we can laugh about it.
Yes,
That
yes.
Oh my
time,
God.
it was not
I
funny.
remember. Oh
It
my
was not-
God.
I must apologize. I remember. I remember calling Dr. Belej-Rak and she's saying, I don't think I was professional. I must apologize.
That's
Because
okay.
I can't remember how I sounded to you, but I was sounding like, what? You have to come right now. I don't want to. He said, why don't we come downtown? And there was something you were suggesting, but I was not hearing it at all. I was like, wherever you are, you have to come right.
It was scary, though.
Yeah,
It
but
was really
I appreciate-
scary. Yes.
I appreciate that
honestly.
you didn't lose it with me. You were still calm and gentle. I think you came and met us down.
Yes, you can. Yes, yes,
Oh
yes.
my goodness, it was terrible. It was terrible. But okay, so after that, and then so
Then
Tell
we
me.
then we met to review the results, so to go over the embryos that had been created,
Yeah.
and I think you had a lot.
Yes.
We had lots of good embryos,
Okay.
and so then we decided to do the first transfer, even still without the surgery for the fibroids.
Yes,
Yeah,
yes,
yeah,
I
yeah.
remember.
Because
Yeah.
we wanted to see, because if it works, fantastic, and then we can avoid the surgery.
Mhm.
And we did do the transfer. However, unfortunately, we had the miscarriage.
Yeah.
yeah, she had a miss. Oh, that was
yes.
terrible. That
Yeah.
experience. I think I was working.
You were at work.
I
Yeah.
was at work. I had to because yes, I still work. I'm still into construction. A lot of you think because we do all this media stuff, we no longer work. I'm an architect. Erica is an architect. We own a construction company, and we still do construction. So bring your construction business to us. Anyways, that night I was. We had a job that we were doing. We only had to work in the night,
Yeah.
so I was there with my
I think
crew.
it was one of the hotels downtown.
Yes, and I was working, and she calls me. Was it you that called me or my?
I called you. No, I called you.
Okay, I called,
Yeah.
but it wasn't me that got you to the hospital.
No, it was my sister's husband.
Okay, okay, yeah.
My brother-in-law.
Yeah.
Because he was closer. They were like
yeah.
10 minutes drive from us.
So
Yeah.
I come and then it was so painful because this is something we
Waited
had
for.
waited for. We had
Longed
gone
for.
through
And worked so
that.
hard for.
Oh, yes.
Worked
Oh,
so
yeah.
hard
Yeah.
for all those cycles. It was very 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 painful.
Yeah.
You
But
know-
I don't know. I keep, well, I say I keep blaming myself because I didn't really know the signs of contractions.
Mhm.
And this has started long in the afternoon, early afternoon, like 1, 2 o'clock. I kept feeling that, and I went down, did laundry, came up. If I had known that was, when I called, when I called the hospital, I kept telling them cramp. And they went with cramp. If I knew that feeling, they would have rushed me to the hospital earlier than then. you know, and maybe, who knows, I don't know.
Honestly, there's nothing you did and nothing you could have done to cause it or prevent it. So it's don't blame yourself.
Okay. Okay.
Me too.
I felt so bad.
No.
No.
So after that, so we came back.
Yes. So we recovered from that, and then we talked about our options, which would have been to do another transfer.
Yeah,
or
after the
to-
surgery. I think we had the surgery after that. Yeah.
Then and we talked
Was
about
that was that when we considered surgery?
Yes.
Okay.
Yes. So when we met, the options would have been to either do the surgery before the next transfer,
Yes,
or
yeah.
to do another transfer.
Okay.
And we decided at that point that we were going to go with
Surgery.
the surgery.
Yes.
So I referred you to Dr. Grace Liu.
Yes. Fantastic.
So-
Another fantastic
all of you guys,
doctor.
you guys are like
Yes.
like three angels.
Yes.
From one
It's
angel
true, it's true,
to another
honestly.
angel
Yeah.
to another angel.
Yes.
Guys, we're gonna try to also talk to her. These are people that you need to get to know and see. They're especially angels, not human beings.
Yeah.
So you recommended us to
do to take out the fibroids, and now that surgery, I can't recall whether she did it with whether you needed to have the cut or whether it was the one through the belly button.
No, I had to have a cut.
Yeah.
Yeah, she
Yeah.
cut me up. Yes.
because there were
yes.
plenty.
They were
Yeah,
yes.
multiple.
Oh, there were
yes.
plenty.
And really big.
Really
Yes.
big.
I think
Yeah.
she said the biggest was the size of a baby's head.
Oh my
baby's
goodness.
head.
It was
Yeah.
really- it was really
It was really
big.
big.
It was
Yeah.
really big.
And then I had so many other ones, you know.
Mhm.
But
possible
we
around.
really wanted to get it over with that. The option we had was to do it on a Christmas
Christmas
Eve.
I think it was Christmas
Christmas
Eve.
Eve.
Yeah, that was the only
that was the
opening.
only opening.
Oh, wow.
And we said,
Okay.
take it, do it. At that point, we're not thinking about Christmas or anything.
No. So our Christmas was in the
hospital. Yes.
boy.
Yeah.
Yeah. So we recovered from the surgery, and then we came back.
Yes, and then we set up for our next transfer,
Yeah.
and that one
Yeah.
resulted
Baby.
in our first baby.
Yeah, it was
my
amazing.
God, that was.
Yes.
You know, it's funny. The journey is not easy. All the things that you go through, all the things you have to do, but as soon as you just see that baby,
Oh my God.
everything
Changes.
Just disappears.
Everything
Like,
disappears.
You just forget
Yes.
everything.
Yes.
Everything, honestly. At this point, I must just tell anybody listening or watching that you will forget. You know, when you finally get what you want, when the baby finally arrives, everything that you went through will be worth it. I'm telling you, the
Yes.
money. Now it's subsidized. Then it wasn't.
Yes.
It wasn't
Yes.
subsidized.
Yes.
So we had to do extra hours working. We had just come in. We had to be in school. We came back after 2 years,
Yes.
and then
We did another frozen embryo transfer, and then we have baby number 2.
Yeah.
Ijama.
Okay, so it gets better and better and better, and we have 2 beautiful children that we would not exchange for anything else.
Yes.
And God just used you to perform that miracle in our life, because at the point it was so, you know what, I see that you actually forget. I try to remember some of the experiences, but it's difficult. But we had times when someone in our family had to send a text to her after we got married and told her that she was a barren woman, and she was wasting her time in our family, that she would never have a baby.
Oh my goodness.
Sent that text, and we know the person up to today, but
Yeah.
you just have to forgive
Yeah.
and get going. Dr. Belej-Rak, could you speak to people who have issues with childbearing? Because a lot of people they've confronted obstacles. It is a limitation in their life. They've been told by going to so many places that they will never have a baby, and they've been directed to places that they should not be going to. So tell us what you are capable of doing, what is within your limits, and options that are available to a lot of people.
So I encourage everyone to educate themselves as much as they can. I empower them with information and to come and learn about the options. is but without coming to speak to us, you might not be aware of everything that is available. So we have very minimalistic approaches where we even just by monitoring someone's cycle, and even though they've been using their ovulation kits for a year, just by coming here and giving them that extra energy and the extra hope for that one cycle, many of our couples conceive just with that. After that, we have the lifestyle changes and other things that we can help with, such as supplements or even acupuncture, dietary changes. So many things that are pretty minimal in terms of interventions. Then we can start medical treatments if need be, where we do what we started with you, the insemination with some pills, for example, and then we have the most advanced technology of the in vitro fertilization. We can even help with donor sperm, for example, for either single women, same-sex couples, or men who do not have any sperm. For those men, though, we can even take sperm from their testicles or the epididymis. So it's incredible what we can do to help. And then sometimes we need to use a donor egg, so that's an egg from another woman, and use her partner's sperm, and she carries the pregnancy if she has, for example, run out of eggs, or if she's older. And then even there's gestational carriers, where if there's an issue with the uterus, then we can create the embryo and another woman can carry that pregnancy.
Wow.
So it's the options are enormous, and
that's amazing.
Can be highly successful.
Wow. Because the thing there is, a lot of people say, you know what, I could never have a baby. I could never. So what I'm hearing now is that there are more options now than there used to be.
Oh, yes.
Wow.
So before you can be told that you cannot have a baby, you would have had to exploit all of these options, and there are so many of them. That's very interesting.
Yes.
Erica was going to say something about, because everything is, I've met people, even in my profession and in so many professions. As a professional, I understand this. Some people go to school, they train in a particular profession, and they practice to the letter. They cross their T's and they dot their I's, and in their approach to you, if the books say option A, B, C, sorry, nothing we can do. But I find out that there's also something that sets one professional apart from other professionals.
Oh, definitely.
And that's what Erica was beginning to talk about, and I wanted that to say.
For your case, Dr. Belej-Rak, you had a human side of it. You weren't just a doctor to us, you were a human being. You felt our pain, you were like part of the family, but you had to do the medical part of it. And honestly, that was something that really, that was one thing that endeared us to you, and kept us going all through. The other doctors that we dealt with, where there was a particular incident that was just I don't want to go there,
the truth was after, because by the time we did the second process, because of the eggs were already
at that facility,
so we still had to use them, but you had moved. That's when we actually appreciated, because sometimes it's when you have tried something else that you get to appreciate the other one more. So that's when it stood out to us that, look, there was a huge difference between this doctor and this other doctor.
If not for the fact that the complications that surrounded extraction, I was ready to go all through it again with you at your new place. Honestly, we're ready to go through it, but then it was kind of complicated. You told us, no, you know what, just stay there. But if we had a choice, we would just forget about that chapter and come and start.
But that was another part of the whole thing, because here you are, you've already moved your practice from that very place. But you didn't want to push. You could have pushed so that would have been
discouraged us. And told come over, let's start over.
Even though they are raised, just do
but
it.
You didn't.
And that would have been selfish. But you just like, what? So you were more after this. You were considering us more than yourself and your business.
Yes.
I really want to say thank you.
Thank
for
you.
That. And
Yes.
That's why we're recommending everybody in the whole world to come see.
Yes, we're going to share her contacts at the bottom.
Yeah.
At the bottom link, so you can please freely. She comes in highly recommended. You
And
have to contact her.
every other person we've
Yeah.
sent to her since then, they've had 100% success rate.
Yes.
We're not just saying it for saying sake. This is somebody that we know very well. That's why this program this particular one was a little bit different for us.
Yeah.
Okay. Anyways.
Now you're making me this is why I do what I do. I love what I do,
honestly,
and I have learned so much from my patients, and that's why I believe in miracles, and they've taught me miracles do happen and can happen, and I say if you don't want to give up, don't give up.
Yes.
And then I've learned to incorporate the other modalities into my practice, like the naturopaths, the acupuncture, the Chinese medicine, counseling, mind-body medicine. So there's so much that comes into creating life other than just the medical part, and the spiritual part as well.
Yeah.
I think it's because we're Christians, and we're very strong Christians, and we understand God and the way He operates. So I think anybody who is involved in creation of life, if they are not close to God, and if they don't approach it with their heart, then I don't think that practice will survive a very long time. I think God is more willing to work with people who are attuned to Him, who have that compassion, because for us that's how He is. He's compassionate, He's caring, He's loving. So when you have all that attribute, you're actually a messenger and a tool for God. You don't have to be a pastor or somebody, a minister to be that. And we believe God is using you as an instrument of His. And that's why you see yourself operating in this way. And that's why you're going to be having, you will have challenges and obstacles, and because this is from our spiritual perspective. Anybody who is involved, and you might not know this, and I'll just let you into this, and you might just check it with your life. Anybody who is into procreation, anybody who is into creating life, the devil doesn't like them. So the devil doesn't want life to increase. The devil wants life to decrease, and for people not to be interested in bringing life and nurturing life. So people who are involved in that, challenges, obstacles, limitations, they always have to deal with them. But one thing they know is that they will always succeed, because the person who they are working for, who is their big master, will always be there to make sure that they succeed. So that's why you will succeed in spite of every obstacle. That's why you're still standing today.
Thank you. With a few.
It's okay.
It's along the way.
Like a warrior. These are backs of what you see that one. I got it from that battle. You see that one? I got it. You see this one? But we really appreciate you, Dr. Belej-Rak.
We do.
Thank you.
From the bottom of our hearts.
Yeah.
We do.
We do appreciate you. We thank you for everything you've been. You've been a family to us. You keep asking after the kids. You keep liking the pictures. You keep coming to check in on us. We send people to you, and instantly you advise them. We appreciate that, and we thank you for sparing time out of your crazy schedule to have this discussion on this program with us. And please, when we bug you again, please find time to chat with us again. Thank you very much.
Thank you from the bottom of my heart.
Alright, so guys, that has been a special guest on this special program, Dr. Belej-Rak, talking to us about your fertility choices, and I hope you guys enjoyed it. Everything about Dr. Belej-Rak will be in the description. It will be in the we'll pin it up in our comment section, and you can always contact us to reach her, or you can go to their website and you'll be able to make contact with them. From all of us